With coronavirus cases spreading worldwide, you're likely to see some alarming headlines. Well, here are 5 new things about the coronavirus outbreak you need to know and the important context behind them.
Health officials in Washington confirmed Saturday a man in his 50s who tested positive for COVID-19 has died. While the news is alarming, the health department there says the man suffered from underlying health conditions and the outcome is rare. The Texas Center for Infectious Disease in San Antonio is treating 11 people who have tested positive for coronavirus. 9 of them are from the group of Diamond Princess cruise ship passengers under federal quarantine. One is an evacuee from Wuhan, China, and another was flown in from California. Health officials say no other cases have been reported in San Antonio. Officials in Hong Kong are working to verify or rule out a pet dog has contracted COVID-19. The World Health Organization is keeping an eye on this, but says with past coronaviruses and what they know about this one, there's no proof household pets can spread the disease. The U.S. Surgeon General is urging healthy people to stop buying masks, saying they aren't effective in preventing the disease in the general public. In addition to health workers, the CDC says face masks should be worn by patients who are already showing symptoms of COVID-19 to stop the spread. And as of Saturday, the White House announced new restrictions which ban travel to the United States from Iran and urge American travelers to avoid regions of Italy and South Korea where COVID-19 cases have spiked. Despite the alert, President Trump advised Americans not to overreact.
Because there's no reason to panic at all.
Now, despite these growing concerns, the Director General of the World Health Organization tweeted, "Our greatest enemy right now is not the coronavirus itself. It's fear, rumors, and stigma. Our greatest assets are facts, reason, and solidarity." In Dallas, I'm Eric Alvarez.